Discussing quality improvement tools in healthcare with a particular focus on the cause and effect diagram, also known as the Ishikawa diagram or fishbone diagram. We will explore how this tool is applied in clinical settings, its advantages and limitations, and how it relates to broader issues of patient safety, including responding to adverse events. It's a fundamental tool in quality improvement and sets stage for understanding how the diagram helps teams to identify and analyze root causes. The cause and effect diagram was developed by Dr. Ishikawa, and it's one of the 7 basic quality tools. Hence, it's also referred to as Ishikawa diagram. It's an organizational tool that triggers teams to explore and display as many causes as possible that may be contributing to a particular effect or outcome. It allows a systematic identification, sorting, and display of possible causes of specific problem, and also provides graphical illustration, relationship between cause and effect. Visually, it resembles skeleton of a fish. The head represents the problem or the effect. It's placed on the right side. The horizontal backbone extends to the left. Major causes branch off as main bones, while minor branch off as sub-causes. This hierarchical layout helps teams to break down complex problems into manageable parts for thorough analysis. The bones branching off represent categories of potential causes, commonly people, methods, equipment, environment, and materials. These are standard categories. You could also consider other categories like machines, measurements, policies, procedures, and space. Asking why at least 5 times for each major cause will help us to drill down into a more detailed causal factors, leading to identification of the underlying root causes. This ensures analysis reaches its useful level of detail for improvement. The actual process of creating categories starts with brainstorming session and repeatedly asking why. During the brainstorming session, sticky notes are created and jotted down upon. This is done in no particular order by each member of the team. Then the team sorts them out into categories. The team members silently read and arrange these sticky notes based on similar care processes, themes, or pathways. Then a heading is assigned to each category at the end of this process. The duplicates are removed and an order is created. Typically, this results into between 2 to 6 categories. There's flexibility in containing similar information, and it's useful to display in a pictorial manner so that people would understand the cause and effect better. Let's take a real-time example. In this setting, there was an inefficient ward round practice in a busy tertiary hospital. This resulted into many near misses and some sepses involving inpatient, and Quality and Safety Directorate got involved. Brainstorming involving major stakeholders identified major categories as people, environment, materials, equipment, and methods. Further drilling down and asking why led to identification of subcategories as junior doctors, senior doctors not being available, conflicting duties, and spaced out wards. At the end of this exercise, a fishbone diagram was ready, and it visually organizes the categories and causes identified and shows the relationship of these causes central to the problem. The visual aid was crucial for the teams to understand and see the full scope of contributing factors and prioritize areas for intervention. Advantages. Fishbone diagram encourages brainstorming of detailed causes. Repeatedly asking why leads us to come to reach some understanding of the major causes and further the sub-causes. This helps the teams to refine and eliminate causes that do not apply, leading to a more focused discussion on most important root causes. Fishbone diagram offers clear visual organization of causes and subcauses and helps the teams to explore and display as many factors as possible which are contributing to the effect. The pictorial representation aids in understanding the complex interrelationship and identifies key areas for improvement, making them accessible and actionable. Its main key factor is allows us to drill down and perform nearly root cause analysis and gets to the bottom of the issue and identify possible solutions. It's particularly useful for investigating adverse events or errors, and it's often used in conjunction with root cause analysis. However, it's not without limitations. It can be used only after initial brainstorming and idea generation. And there needs to be a high-level organization of these ideas. It usually follows affinity diagram creation. The level of detail reached depends on the team's judgment and the issue's complexity. It's important that the team maintains understanding of the issue so that they can reach a useful level of detail, ensuring that the causes are specific enough to test a change and measure the effects. Some people may prefer the display of affinity diagram compared to the cause and effect diagram. So sometimes it boils down to personal choice. So the right way of using fishbone diagram is to have brainstorming first, followed by fishbone diagram to categorize and organize, and followed by further root cause analysis. In the example provided, root cause analysis came to conclusion that board rounds was not performed in an appropriate manner and laid down some structures for the board rounds, recommended improvement in staffing and role clarity, and also emphasized some organizational priorities and culture. In conclusion, fishbone diagram is an important QI tool, and these are quite effective tools, but they need proper context. It is not effective when used alone, but is more effective when it's followed up by root cause analysis. References.